As the coronavirus continues to spread through our region, we are keeping a close eye on high case volumes here in the metro. During their daily meeting, doctors with the University of Kansas Health System said they have fewer active cases today, but 138 total COVID cases, 93 active, 44 in the ICU, 23 now on ventilators. Kansas City Mayor Quinton Lucas joined this morning's meeting. He says it takes a regional effort to keep our communities safe.
What can I do to keep the highest number of Kansas Cityans safe? And the true story is that means that I have to care about how we're keeping people of Upland Park safe and of Liberty and so many other places around us.
The mayor says he is altering his own holiday plans and encourages others to do the same. And with the upcoming holiday, there are fears that the spread between family and friends could send cases past 20 million by the end of January. That prediction from researchers at Washington University in St. Louis. They say hospitalizations have escalated across the country, and ICU admissions have risen roughly 77% here in the last 2 weeks. And today here at noon, we are getting an up-close look at something most of us never want to see in person, and that's the inside of a coronavirus unit. This is at a hospital in St. Louis. Our sister station, KMOV, was allowed inside because doctors there thought it was important for us to see it.
It's just wearing to come in and take care of these people and see a lot of people just not taking this seriously outside of here. If only they could see what was going on.
A 62-year-old patient agreed to speak also on camera, describing her own experience.
Well, I couldn't taste. I couldn't breathe too good. And my chest was hurting. Okay, well, you want upset? Oh, I want us to be together.
She just wants to be together with her family, she says. And while the pandemic mostly impacts older, more vulnerable adults, hospitals are now seeing more patients as young as in their 20s. You're still planning to travel for Thanksgiving this year? A new online tool could help you make that most informed decision. Here's a look at a new online risk assessment planning tool. It's developed by Georgia Tech. You can adjust the projected event size to see the risk that at least one COVID-19 positive person would add to your gathering. Of course, the fewer the people, the lower the risk. Here in the metro, Platte County considered the lowest risk for gatherings, followed by Clay, Jackson, Leavenworth, Wyandotte, and then Johnson counties. You increase the number of people at your gathering, let's say, to 20, and the order is still the same. But as you can see, the risk makes a sizable jump here. On the low end, from 12 to 22% in Platte County. On the higher end, from 30 to 52% in Johnson County. The head of the St. Louis area COVID task force says the risk is there, even if everyone says they feel fine.
There's a lot of virus circulating out there right now, and if you get together in a large group of people, you're definitely increasing your probability of contracting COVID and then either becoming sick and hospitalized yourself or becoming one of those asymptomatic carriers and then unwittingly passing it on to more vulnerable people.
Well, doctors at the University of Kansas Health System also talked about holiday gatherings this morning. Dr. Stephen Stites saying that altering your plans or staying masked up may seem tough, even if it is the right thing to do.
This Thanksgiving, remember that some ways the best way to say I love you is to wear a mask. Because if you don't and you make somebody sick, what did you really just say?
AAA is predicting about 50 million Americans still intend to travel for the holiday.